Why does the diagnosis of major depression and bipolar depression in teens and preteens often stir confusion among healthcare professionals and parents? As we delve into the labyrinthine world of diagnosing depression in young people, it's important to understand that the challenge begins with the overlapping symptoms of major depression and bipolar depression. Both conditions can manifest with similar signs, such as persistent sadness, loss of interest in previously enjoyable activities, and significant changes in appetite and sleep patterns. This symptom overlap often creates a diagnostic conundrum, making it difficult to differentiate between the two conditions. What further complicates matters is the inherently fluctuating mood states in adolescence. The teenage years are a period of significant hormonal changes, which can result in mood swings that mimic the symptoms of bipolar depression. Yet, these mood swings could merely be a normal part of adolescent development, rather than a sign of an underlying psychiatric condition. This is why it's crucial not to rush to a diagnosis, but to observe the young person's mood states over a period of time to discern patterns. But the complexity doesn't stop there. The role of family history and the biopsychosocial presentations of depression in young people add another layer of intricacy to the diagnosis process. Family history of depression or other psychiatric conditions can predispose a young person to similar conditions. However, it doesn't necessarily guarantee that they will develop these conditions. Similarly, the biopsychosocial presentations, the interplay of biological factors, psychological influences, and social environment, can vary greatly among young people, further complicating the diagnosis. And lastly, the diagnosis of depression in young people is not a static process. It's often a work in progress, with the psychiatric diagnosis potentially changing over time. It's more akin to watching a movie, observing the evolving narrative, rather than looking at a single, fixed photograph. As we can see, the diagnosis of depression in young people is far from straightforward. It is a nuanced process that requires a comprehensive understanding of the young person's family history and biopsychosocial presentations. But how do major depression and bipolar depression in young people differ, and why are these differences significant to the diagnostic process? Major depression and bipolar depression, while sharing a common thread of depressive episodes, present quite distinctively in young people. Major depression, often characterized by persistent sadness, loss of interest in activities, and feelings of hopelessness, is a continuous state. On the other hand, bipolar depression alternates between these depressive states and periods of extreme elation or mania, creating a roller coaster of emotions that can be challenging to navigate. The differences don't stop there. The duration and severity of these conditions also play a pivotal role in diagnosis. Major depression can persist for weeks, months, or even years without any significant mood elevation. Conversely, bipolar depression can cycle between its polar states in a matter of days or weeks. This rapid cycling makes bipolar depression particularly difficult to diagnose, as the manic episodes can often be mistaken for normal mood elevation following a depressive episode. These distinctions are not merely academic. They carry significant implications for treatment. While both conditions can be managed with psychotherapy and medication, the specifics of the treatment plan can vary greatly. For instance, the use of antidepressants, while beneficial for major depression, can trigger manic episodes in individuals with bipolar depression. Now here's where things get even more complex. The diagnostic criteria for these conditions in young people are not set in stone. They can evolve over time, mirroring the dynamic nature of adolescence itself. This means that a young person diagnosed with major depression today may meet the criteria for bipolar depression tomorrow, further complicating the diagnostic process. In essence, differentiating between major depression and bipolar depression in young people is a delicate task. It requires careful consideration of the individual's symptoms, family history, and biopsychosocial presentations. But with the right knowledge and approach, we can work towards a more accurate and effective diagnosis.